For being here. I am Bibi. We are on our first Tuesday event. We have two special guests. Today we have with us Dr. Mauricio Cerpa,
Still going to be here the 18th and 19th.
advisor in emergency healthcare,
You two
and Dr. Leonardo Hernandez, Chief
Yes.
of Emergency Operations.
Next question. Do you care if you're a second start on Thursday?
Somebody needs to
Someone has his microphone open. Wow. Bueno, y queremos presentar hoy lo que es la Organización Panamericana de la
we would like to present the Pan American Health Organization,
Objetivos.
what its objectives are, its strategies,
Van a hablar un poco también
and we're going to also speak a
iniciativa que
little
es
about
salud,
the Cluster Health Initiative,
y apoyar el derecho de todos a la salud.
which aims to realize the right to health for all.
Muchísimas gracias por haber aceptado esta invitación.
Thank you to our two guests for accepting this invitation.
Estamos muy contentos
On
de
behalf of the
tenerlos aquí
G4 Alliance,
y poder conocer más
we are
acerca de
very
cómo
interested to learn more about
la OPS
the work of the
en
PAHO
Latinoamérica y
in Latin America,
Colombia y obviamente conocer
and
más.
specifically in Colombia in this area of cluster health. Welcome.
Muchas gracias definitivamente por la invitación.
Thank you for the invitation.
Una pregunta, dijeron que iban a hacer traducción, ¿es que preferirían que
One-
hagamos la presentación en inglés o prefieren que la hagamos en español o igual?
One question about doing interpretation. Bibi, could you explain?
Tenemos personas que hablan en español, entonces
So we have some people who speak Spanish, so I think it's good you speak in Spanish, and Jody will provide the interpretation into English. But if you could speak slowly, that would help with the interpretation.
Pueden hacer la presentación en español.
But you can do your presentation in Spanish.
Perfecto. Si le parece, primero me presento, después invito
Por
al
favor.
doctor Leonardo y empezamos.
So I will introduce myself.
Yo soy Mauricio Cerpa.
I am Mauricio Cerpa. I am an epidemiologist.
La Organización Panamericana de
I've been
Salud.
working for 3 years with the PAHO.
Me especialicé en salud pública.
Public health is my
en
specialty,
la parte de epidemiología.
and then I subspecialized in epidemiology,
Trabajar en todas las emergencias en salud.
and I'm working in health emergencies.
2 años en Colombia.
I've been in Colombia for 2 years.
Un tiempo en Haití y antes también en la sede regional en Washington.
I've also been
Le dejo
in Haiti, and I've also worked in Washington, D.C.
Buenas tardes. Muchas gracias por la
Good
invitación.
afternoon.
Soy
Thank you for the
Leonardo
invitation.
Hernandez, soy médico,
I'm Leonardo Hernandez. I'm a doctor,
especialicé en análisis de
Colombian.
riesgos y prevención de emergencias.
My specialty is in emergency medicine.
Trabajo soy el jefe de la unidad de operaciones de emergencias de la OPS bajo el departamento.
I have worked in the PAHO in the emergency area
Unos cuantos años trabajo
for-
en la OPS desde el 2004.
since 2004.
Entonces nos volvimos viejitos en la OPS.
So we've been growing old in the PAHO. Thank you very much for the invitation.
Una última pregunta antes de empezar. porque
One other question before we begin.
¿Cuánto tiempo disponemos para la presentación?
How much time do I have for the presentation?
Tranquilo, doctor Cerpa. Originalmente tenemos un espacio de 1 hora.
In total, we have an hour.
Y generalmente nuestros expositores
Our
van
speakers
alrededor de 30 o 40
generally
minutos. Siempre
speak
dejamos
maybe
tiempo para
30
las
minutes,
preguntas. Puede ser menos tiempo si
but it
ustedes
could be
quieren.
less time if you want to leave more time for
Nos tomamos
questions.
1 hora. A la hora
But-
ya estamos terminando.
In total, we generally take about an hour.
De acuerdo.
Okay,
Voy a proyectar la diapositiva.
I'm going to share some slides.
Gracias.
Con la presentación a tu ordenador voy a presentar en uno y hablar en el otro.
Perfecto.
So I'm going to present in one language and speak in the other.
Sí, sí, señor.
I think you can see this, yes?
Ok, entonces en la presentación intentamos incluir 2 temas.
We tried to cover 2
Vamos a empezar
topics.
un poco desde la perspectiva de qué es la OPS,
And we're going to talk a little bit about what
de
is
qué es la OPS como
the
organización,
Pan American Organization of
después
Health,
ya las especificidades de un poco de la oficina en Colombia,
and then a little bit
finalmente
about
pues,
specifically what we do in the
el área
Colombia office,
de emergencias en salud y el cluster,
especially in emergency healthcare.
donde con Leonardo pues completaremos todas sus dudas.
And then we, with Fernando, with Dr. Hernandez, will answer all your questions.
En Colombia, tener en cuenta que la OPS es la organización internacional.
So the PAHO is an international organization specialized in public health in the Americas. At the world level, it's the oldest health organization in health, dating to 1902.
Desde 1902 y trabaja con todos los países de la región.
Here, the PAHO works with all of the countries in the Americas
Y brinda cooperación técnica
to improve and protect health, and we provide technical support.
La visión de la OPS es
The
ese catalizador para
WHO vision is to be the catalyzer to make sure that the entire population of the Americas enjoys optimal health and contributes to the well-being of their families and communities. Our mission is to lead collaborative efforts and strategic efforts among the members and allies to promote equity in healthcare, to combat illness, and improve quality of life in all communities of the Americas.
y prolongar la duración de la vida de los pueblos en las Américas. Esta es una rápida cronología.
This is a quick chronology. So the World Health Organization goes back to 1902.
En la cronología, como les contaba, desde 1502.
As I mentioned, dates back to 1902. It was called the International Sanitary Office in Washington. Then another important date was 1923, when the Pan American Office was established. And then in 1948, the World Health Organization came to be. And in 1949, the regional office in the Americas was established. And the next year recognized as a specialized institution. Colombia joined the office, the organization in, I missed the date. So the WHO directs and coordinates health actions on behalf of the United Nations. It's divided into 6 regions. The PAHO actually has its base office in Washington, D.C. and covers all the parts of the map that were in red, all of the Americas. So it's very important to outline that the Pan American Health Organization is divided into directive bodies. One is the Secretariat. It's made up of all the member countries. Every 5 years, there's a conference where the 44 member countries gather. And it also works through its board of directors and its executive committee. In the board of directors, which is made up of the health ministries of all the member countries. They plan the actions. So the PAHO has 4 overall axles of work. They are gender, equity, human rights, and ethnicity. And some of these strategies for equity in healthcare include promoting universal healthcare, advocacy for healthcare, promoting primary healthcare and social protection strategies, and promoting health across all politics and policies. Talking about Colombia, over the last 3 years since 2020, we have people on the ground doing work in all these different regions, in 27 out of 32 departments, and in 209 out of over 1,000 municipalities. And we work especially reinforcing in the municipalities that have most urgent need of interventions, those that have suffered from the armed struggles.
Respecto a las áreas de cooperación técnica, Oficina de Colombia, estamos
Talking about the types of technical support that we provide, we're working in 5 different areas. All of them are really trying to promote universal access to healthcare. A lot of focus in equity, to have integral healthcare for all people and families and communities across different populations. We have focuses on reproductive health care, we also are providing technical support in the area of prevention of contagious diseases and non-contagious. And the area that I direct here in Colombia is the strengthening capacities for prevention and response to emergencies and disasters. And the 5th area is the issue of leadership and management in healthcare. In the PAHO Colombia office, the person in charge of our office would have liked to be here, but is out doing field work. But she is very interested in and says hi to everyone and wants to support our work. So now I want to talk a little bit about the emergency healthcare work within the PAHO. And I want to talk a little bit about the current situation specifically in Colombia in relation to natural disasters and emergencies. The first 2 images here reflect the armed conflict. There are more than 23,000 people this year who have been forcibly displaced from their homes due to armed conflicts. And there are other people who are trapped in their communities, sometimes in overcrowded conditions. And sometimes it's very difficult to reach and treat these communities. And these numbers of these populations, even though 4 years ago we signed a peace treaty, these issues are still increasing and happening. We recently have a new government. This new government is trying to re-implement the peace treaty, trying to stop the armed conflict. So we think this is an opportune time to focus our work. And a lot of our emergency focus there's certain areas that are common in emergencies. You often see in emergency situations, you also often see a sharp decline in maternal healthcare. You see more maternal mortality, more children, pediatric mortality, and you also see more pregnancies in children and adolescents. It is also a big crisis that of the high percentage of people who are more than an hour away from any healthcare center. At least 8 million people are more than an hour away from any healthcare. And 2.2 million have high barriers to access health services. We also have the problems of access to humanitarian care, and healthcare is also restricted because of attacks that have happened against medical personnel and due to geographic challenges. So we've also seen that maternal health has increased 12% since 2020, and HIV status has also worsened in these years. Another issue that's important to address, talking about healthcare in Colombia, is the immigration from Venezuela. We have about 2.5 million refugees or migrants living in Colombia from Venezuela.
Hasta ese momento se estimaba que había 1.7 millones de venezolanos. Cuando se hizo el momento de la preinscripción, pues al final se dieron cuenta que estaba subestimado. Al final
So the government offered to normalize the residency of all these Venezuelans. Originally, they thought there were only 1.7 million. But then when they started actually counting, they found they had undercounted. So this whole population, they're trying to regularize them because they need to be registered in order to be able to successfully access healthcare.
Y en el tema de migración, pues también está lo que se le llama los migrantes pendulares, que son aquellos migrantes venezolanos que viven en territorio venezolano y que cruzan las fronteras diariamente.
There are also a lot of other Venezuelans who come back and forth from Venezuela, temporary migrants. They might be another 5 million. Then there might be another 125,000 Venezuelans who are transiting through the country. So these are issues of extracontinental migration. Also with the crisis in Haiti in the last year and a half, there actually are Haitians who end up here. And also the migrants who are trying to cross from South America north have to pass through the Darien Peninsula between Colombia and Panama in that border area. And it's a very dangerous border area. It has been the most vulnerable time for the health and safety of migrants. And we need to address the needs of the patient, of the population migrating through this region, which is just beyond the Colombian border. So talking about the health situation of this migrant population, these are some of the illnesses that they most have. Whooping cough, dengue, a lot of infectious diseases, a lot of mental health issues, also sexual and reproductive health crises, a lot of STDs among adolescents. There's a lot of sexual violence. We need to be constantly monitoring and addressing these needs. So we work with a lot of other partners. The National Risk Management, which is part of the Colombian government. Also the Health Ministry, the Colombian Office of Migration, other cooperation bodies. And talking a little bit about the humanitarian response team that we have in Colombia. There are a number of different NGOs. This shows the structure of all the different organizations that are working together. So in Colombia, talking about cluster health, we have 7 clusters established in Colombia. They are in the areas of social protection, food security and nutrition, water, sanitation and hygiene, housing, health, early recovery, and education. And there are different local coordination teams working in these different areas in the different population centers. So all of these are different ways that we're trying to coordinate humanitarian efforts with the Colombian government. And this addresses a little, what is the presence of the PAHO in the different territories of Colombia? So all these red markers represent where PAHO personnel are actually stationed and working. I'm going to do some changes here with the presentation. Give me a minute. Talking about the cluster health, there are now 23 countries that have an activated cluster. So the example that I showed you of Colombia gives you an idea of how it works. We have 3 activated clusters, one on children, one on maternal health, and one in healthy mental health and healthy living.
Creo que muchos de ustedes, si tienen acciones en en Colombia, pues sería también, les hacemos una invitación para que
And if any of you have work in Colombia, we'd like to invite you to connect with us and form part of one of our clusters.
Este escenario de articulación y coordinación junto con la autoridad sanitaria para la respuesta a brechas y vacíos en cualquiera sea la emergencia. Y muchas veces, pues
So the cluster that I work in is focused on responding to emergency scenarios.
múltiples emergencias pasando al mismo tiempo, ya sea tema de desastres naturales, flujos migratorios.
They can be, there's all kinds of emergencies ranging from migration flows to natural disasters.
Hemos empezado a promover que esta organización pues también se logre hacer a nivel territorial y es lo que le llamamos, le hemos puesto el nombre de mesas de salud. Hace poco tuvimos un primer encuentro.
And in the area of, we've been trying to establish health tables, kind of health roundtables in different parts of the country.
Y realmente yo creo que ha sido muy positivo porque se puede compartir entre ellas experiencias y cómo mejor identificar esas brechas que existen.
And these roundtables in the different territories have been really helpful to identify where are gaps, where are the needs, immediate needs that need to be addressed. We also do a lot of work just in managing information. Again, identifying where are gaps in healthcare and gaps in emergency response. And we've also developed a tool where we're trying to map what are the factors we're trying to map out the needs and mapping out what type of responses exist to the different needs and identifying where we are lacking. And we're discovering there are some regions that the needs are more well known, but there are other areas that are just not as identified. And speaking of our health roundtables, we have 19 roundtables established in 11 different departments and 8 municipalities. They are working at different levels. Some of them are more advanced than others. Some of the focuses of these groups have been developing effective coordination among actors. These roundtables have been focusing on. They've also been evaluating and analyzing needs. And these are some of the components of these health tables. Recognizing the current consequences and possibilities that are coming out of health emergencies. Also identifying the relationship between needs and risks in public health and the exact vulnerabilities of the affected populations, which really can vary a lot among the different contexts of the communities. Our objectives are to reduce mortality and morbidity, avoid discapacity, and restore equitable access to preventative and curative health care. These are some more objectives of the roundtables to develop strategies to improve public health. Some of the gaps that some common gaps we've identified. Some are just lack of really providing solutions.
hacer un diagnóstico, una evaluación. Eso sería
It's not enough to go to different places and do a diagnostic to evaluate what the problem is. We have to really find effective
lo
solutions.
que hayamos identificado que son las necesidades. El otro tema importante es que somos complementarios y no sustituir el sistema de salud.
And the other thing to remember is that we are here to complement, not to substitute the Colombian Health Ministry.
Que vayan más allá también de la atención primaria en salud.
And we are not working really beyond primary health care.
El otro tema que estamos viendo como clúster es que
Another area that the clusters are looking at,
lugares en los cuales nos estamos concentrando mucho como socios, por ejemplo,
we're realizing that we're concentrating a lot of our work in urban areas.
25 socios actuando en esa zona porque es la entrada, digamos, donde hay mayor entrada de migrantes, pero por ejemplo áreas no muy lejanas a norte de Santander como Guainía, Bichada, Guaupés, etcétera.
But we need to understand the needs and respond better to the rural and peripheral areas.
Los socios siempre tienden a concentrarse un poco en las zonas urbanas.
But it's a weakness of the PAHO. We tend to concentrate more in the urban areas. But it's in the rural areas is where they encounter the most barriers to healthcare. So we need to better prioritize and focus in the different rural territories.
La comunidad al final es el primer actor tanto para la detección como para la primera respuesta que ellos van a poder dar. La población, hay una población sin afiliación de salud, hemos hablado, les
There's
mostré
also, we've mentioned, there's a really large population, about 2 million people who are not registered in any healthcare network. They're not affiliated with the healthcare system.
necesariamente significa acceso a salud y no solo tener acceso a la seguridad social necesariamente implica que vas a tener un centro de atención cercano para que
And
puedas.
even once they're registered, it's important to make sure that people actually have a healthcare provider system close by. And it can't be a standardized system for everyone. For example, for the migrant population, we need to have a response specifically for their needs. Another important area is care for patients with chronic and with especially high-cost illnesses. We can't just provide basic primary care. We also really need to address more specialized needs and more complex illnesses.
No suelen estar incluidos en nuestras actividades y por ejemplo en esta encuesta que hicieron respecto a la regularización de migrantes pues se veía.
So for example, in the survey that we did to try to regularize the migrants and refugees,
pues tenían de por sí ya necesidades a largo plazo con enfermedades crónicas.
So we found that a lot of children already had long-term chronic illnesses among the migrant population. And this represents a big challenge. So we need to be providing technical support, not only for identifying health needs, but also for providing complex care. So that's the conclusion of my basic presentation. And I'd like to invite Dr. Hernandez to complement a little my presentation. Dr. Hernandez. Dr. Hernandez.
O en todo caso,
Acá estoy, un
Creo que
momento.
no está conectado. Ya,
Creo que
sí.
sí está
Ya.
conectado.
Sí, ya lo veo. Sí, ya lo veo, doctor Hernán.
Ok. Voy a tratar de compartir pantalla para
So I'm going
solamente.
to try to share my slides,
Si me lo permiten.
if it will allow me to share my screen.
Ok. Yo creo que Mauricio hizo una muy buena presentación.
Mauricio did a wonderful presentation. We are not seeing the slides.
Una muy buena presentación. La respuesta de la OPS se fundamenta en lo que las oficinas de país logran hacer. Pero
So Mauricio described what the national level offices try to achieve.
estamos expuestos a peligros de huracanes. Estamos en la zona sísmica del Pacífico y tenemos varias placas tectónicas que
Another area of attention for us, we're in a earthquake prone region.
ciudades de más de 2 millones de habitantes, lo cual nos va a generar muchos
We have more than
problemas.
2 million people who are in high-risk earthquake zones.
Leo, no sé si estás presentando, pero no lo vemos.
No lo veo. Oh, perdón. Perdón, a mí me parece que sí estoy presentando. A ver,
Ahora sí.
ahora sí. Ok. Ahora sí.
Sí.
Ok, perfecto. Entonces, les decía que
So as I mentioned,
les decía que la región está expuesta a muchas amenazas, a muchos tipos de
our region is impacted by a lot of threats. Of course, we have hurricanes
transcurrido en el Pacífico y en el Atlántico.
that can occur either in the Atlantic or Pacific, can affect us.
Hay placas tectónicas en todo
Also, we have tectonic plates through our region that can cause earthquakes.
También que nos hacen susceptibles a tener sismos y tenemos ciudades con unas densidades de población muy altas.
And we have regions with very high population density.
2 millones de habitantes que pueden ser factibles y que han ocurrido antes de que hubiese tanta población en esas zonas. También tenemos múltiples amenazas de origen biológico y demás. Estas son las amenazas que hemos atendido solamente en los últimos 3 años.
So these are some of the emergencies that PAHO has had to address in the last 3 years in the region, aside from COVID, of course. Hurricanes, different biological illness outbreaks like measles, drought, and some structural issues in some countries that used to have a strong economy, but have struggled, including countries like Ecuador and Nicaragua that have had a lot of social unrest and impacts on their national economy. And in Haiti, a number of crises, including very recently a cholera outbreak. And these countries can't confront these massive threats on their own.
Orientar mejor las acciones para que al país le quede más fácil coordinar esos actores internacionales y ponerlos a trabajar en temas que son sensibles para ellos. ¿Cómo hacemos nosotros ese trabajo en general?
So how do we do our work in general? We work to increase resilience in the healthcare sector. We're trying to build more stable hospitals, better built, and have better infrastructure and facilities We're also trying to make, promote more environmentally sustainable constructions and environmentally appropriate constructions.
Cuando las capacidades estén sobrepasadas en los países. Pero no se puede trabajar solo para la emergencia. Hay que trabajar en preparativos para poder.
So we can't just be responding to emergencies. We have to be proactive,
Expertos dispuestos para ser movilizados.
make sure that there are enough professional specialists who can respond in the case of an emergency.
Generar equipos de respuesta en
We need to
apoyo
have regional response teams.
los equipos médicos
There need to be emergency medical technicians in place.
y haya una que sea previsible esa respuesta de esos equipos y no lleguen a poner
There needs to be predictability. Teams need to know how to respond.
y equipos para contención de brotes y contención y respuesta.
We also need to have
Entonces,
different teams who can respond to illness outbreaks.
la respuesta de una manera coherente.
So these are all elements that in the case of an emergency can make a coherent and cohesive response. So when all these local resources can work with the PAHO country level office, then we can develop strategic responses that support and don't replace the ministries of health. And we want to make sure that we're not just creating recommendations, that we're really helping implement. And it's all with the idea that we can make sure that there's rapid response in the case of emergencies. And for that, we need to be able to be reinforcing the local capacities in the countries. So we, as a national level office, we're just putting all of our technical capacity at the service of the health ministry. So we're, for example, providing technical support to respond to cholera, for example. So we activate our clusters to be able to coordinate and have a strategic planned response. So that's a summary of how we try to help the country level PAHO offices.
Muchísimas gracias, doctor Hernández.
Thank you, Dr. Hernandez and Dr. Cerpa.
No sé si en este momento hay alguna pregunta.
Are there any questions?
Pero mientras tanto, mientras empiezan a ver las preguntas, quisiera preguntar yo algo.
In the meantime, I'd like to ask a question.
¿En qué otros países de Latinoamérica existe?
In these health clusters that you talked about, what other countries in Latin America have established them?
Aparte de la respuesta o crear un plan conjunto de respuesta ante desastres y emergencias.
And in addition to developing a plan to respond to emergencies,
Por ejemplo, el de poder asegurar un acceso de cuidados quirúrgicos.
what work are you doing, for example, to ensure or promote access to surgical care or to improve anesthesia or trauma response? In general terms, not just when there's an emergency, a crisis situation, but in general, what are you doing to improve SOTA care services?
Leo, no sé si quieres empezar con la primera parte.
Leonardo, I don't know if you want to respond first.
Sí, o si quieres empezar yo. No, si quiere, empiezo yo y Leo me corregirá porque él tiene la visión realmente mucho
I
más.
can start and
Sí,
Dr. Hernandez can correct
a
me.
nivel de los clústeres de salud, actualmente hay
Referring to the health
21
clusters,
clústeres de salud activados.
activated clusters.
De estos clústeres, claro, si vemos un mapa, y les puedo pasar la página del clúster global donde tiene toda esa información, pero si viéramos un mapa,
I can share with you the link to that shows a map of where these are developed.
de África, algunos de ellos en Asia o Medio Oriente, y en el caso de las Américas hay 3 países con el clúster.
In the Americas, there are 3 countries,
además de Colombia está Venezuela,
Venezuela, Honduras, and Colombia.
Usualmente esto hay todo un proceso respecto a cómo se van activando los clusters que
There's
tienen
a long process
de cada país,
behind activating these
Naciones
clusters.
Unidas, hay todo un proceso en el cual tampoco no solo es el sector salud,
It's not just the health sector
a todo el sistema de Naciones Unidas y entiendo que la
and the whole United Nations organizations are involved. But maybe Leonardo can explain this a little more.
De acuerdo, no. Tal como Mauricio dice, es la organización a nivel global. Sin embargo,
So clusters, it's a global effort,
en la región,
but in our region,
el clúster es una activación de Naciones Unidas. ¿Sí?
so the clusters are a focus of the United Nations.
De emergencia y activa los clústeres.
They want to have these clusters identified so that they can activate them in the case of emergencies. But here in Colombia, we've started working with them. Because this structure that the United Nations is promoting of clusters, we're taking advantage of it.
Durante un tiempo no hubo clúster, pero la OPS seguía liderando el sector salud y agremiaba a los socios alrededor.
So, for example, in Haiti, although there wasn't officially a cluster system, but the PAHO was kind of running one.
Pero como dice Mauricio, es como es ante Naciones Unidas.
Y sobre la segunda pregunta, yo creo que
And in response to the second question,
Viviana, esto que mencionas, porque, o sea, en realidad, cuando uno se imagina emergencias, yo creo que se imagina un poco del terremoto,
when you think of emergency response, but it's important. There are a lot of, it's not just immediate emergencies. A lot of things are like long-term emergencies. Like how we've talked about the issue of COVID, for example. It's an emergency situation that's been going on for 3 years. Or the topic of communities that have no access to healthcare.
El tema, por ejemplo, que mencionas específicamente, si entendí bien, temas de cirugía especializada.
And you asked specifically about surgery. Of course, access to surgical care is really important in these territories. For example, in Colombia, you can only get surgery in the big cities. When you go away from the cities, they may only have very basic primary care. And often the quality is deficient. And in our coordination work, we have different people with different expertise.
tema de viajes por aviones, pues es mucho más factible, pero muchas veces, pues la unión de acciones entre 2 o 3 socios terminan completando una acción mucho más integrada, ¿no? O sea,
So through these clusters, we're trying to coordinate complementary work. We might activate the aerial transport actors to help solve some of these questions.
Mucha más experticia en tema de cuidado de quemados o en tema de cirugías especializadas.
And some of you may have more expertise in burn response, and you could be part of a cluster that could step in to respond when that need emerges.
Ah, por cierto, Leo trabaja en Washington, pero él es colombiano, o sea, conoce.
Ah,
De
ya.
hecho, y
So,
muchas de las iniciativas.
Leo is Colombian, but he works in Washington.
Yo voy descubriendo que ha sido Leo en su época de trabajador de Colombia, pues es el que las ha ido creando, por eso estoy muy contento que nos pueda.
No, tal cual lo dijiste, Mauro, no hay nada que comentar.
Muchísimas gracias.
I have nothing to add to what Mauricio said. Are there other questions? And I'm sorry, I'm not catching a lot. I'm not doing a good interpretation.
No sé si me escuchan.
Sí.
Se escucha. Se escucha.
Carolina has a hand up.
¿Escuchan?
Sí, ya.
Sí.
¿Me escuchan? Bueno, pues muchas gracias por la presentación.
Thank
Mi
you
nombre
for the
es
presentation.
Trabajo aquí, pertenezco al departamento de Policy Advocacy.
I work with the,
Con la oficina en Bogotá, estoy ubicada en Bogotá.
I'm in Bogota
Estoy
working with
emocionada de escucharlos y hay varios proyectos
police
que la
department.
oficina ha desarrollado con migración. Ahorita
And we've
trabajamos
developed a lot of
con
projects with
Mira, y
migration,
estamos desarrollando con Secretaría Distrital.
and we're working with the district secretary.
Perdón, que mi internet está inestable. Con
Sorry,
Secretaría
my internet
Distrital
is
para
unstable.
poder hacer, digamos, integrar el modelo de Operación Sonrisa a el
We're trying to work with
Entonces, estoy muy
Smile,
interesada de
Operation
poder
Smile,
participar en las mesas que ustedes mencionaron
and
para
we've been
poder
wanting to
contar
participate in the
con
roundtables that you
el trabajo que
mentioned.
se está haciendo.
Pues Carolina, no, me parece estupendo tener en cuenta que dentro de las emergencias hay también este componente que es el
That's a-
nexo con desarrollo, ¿no?
I think this would be great.
No solo son estas actividades de emergencia, que sí son probablemente
We need to be able to respond to all types of emergencies and needs.
que necesitamos asegurar de que no hay una línea divisoria en donde acaba la emergencia, sino al final todos.
There's not a dividing line of where something is no longer an emergency. Things happen over time that we need to respond to.
Tenemos una reunión con Laura Osorio y mi persona con
We have a meeting coming up
de Bogotá, porque ellos nos
in
manifestaron
Bogota.
su interés de implementar y fortalecer.
We can
actividades
mention
así que yo creo que
your interest in supporting the healthcare
también
aspects of the clusters.
muchas actividades que se puedan coordinar a través de específicamente en Bogotá.
We can surely coordinate.
Carolina, si nos pasas el contacto, te pongo
So give us your contact information.
Alguien del equipo un poco para que te cuente y si hay interés, pues ya se pueden hacer reuniones con
I'm sure we can set up a meeting.
presentar las diferentes actividades que ustedes tengan. Gracias.
Sí, muchísimas gracias porque la idea pues ahorita también es fortalecer las actividades de cooperación y la verdad la oficina
Thank you. We want to strengthen our office and our cooperation networks. We have had good success in developing different types of alliances with different NGOs, addressing surgical access, nutritional needs. I'll share my contact information with you. We'd like to coordinate with you.
Con gusto.
Gracias, Carolina. ¿Alguna otra?
Thank you, Carolina. Any other questions?
¿Alguien más?
Yo tenía una pregunta, Vivi, si me das la oportunidad.
Claro que sí,
pues
Rubén,
antes,
dale.
Antes que nada, realmente muchísimas gracias por pasar este tiempo con nosotros, por
Thank you so much for spending this time with us.
ustedes tienen una experiencia muy vasta, muy amplia lidiando con
You have a very wide
con
experience
gama de temas de salud, todos críticos para
covering a
el
wide
desarrollo
range of
humano
health
y el
topics
bienestar
and
humano.
human development.
Para nosotros que estamos tan involucrados en la parte de cirugía, obstetricia, trauma,
We are very
lo
focused
vemos
in
como
surgery,
un componente
obstetrics,
importante en los ofrecimientos
trauma,
básicos de la salud que deben recibir nuestras poblaciones.
and
Estamos realmente lo que quisiera escuchar de ustedes,
what I'd like to hear from you,
basado en su experiencia, es qué consejos
based on your
ustedes como
experience,
como
what
grupo de varias
advice
organizaciones que están
do you give to us as different organizations
con esas inequidades que ustedes mencionan, Bogotá,
who are working to address the
siendo
different
una ciudad donde
inequities that you
tenemos
mentioned?
todo versus un lugar más rural donde estaríamos en
We are seeking equity among, like you mentioned, there's huge gaps between, huge differences between the access to care in the cities and the rural regions. And we want to create equity across regions. Based on your experience as the PAHO,
los varios contextos en que ustedes han servido, ¿cuáles son áreas donde como una alianza
what are some
continuar
areas that we as an alliance could focus
para ayudar a esas inequidades,
to address the inequities,
no solamente en nuestra región, sino como una alianza que también busca
not only in our
estos temas
region of the Americas, but around the world?
y nuevamente muchas gracias por su tiempo.
And once again, thank you so much for your time
Gran labor.
and for your great work.
Gracias, Rubén. Tal vez,
Thank you, Ruben.
si Mauricio me permite, yo diría que
I would say
tal vez una recomendación que
maybe
basada
one
en mi
recommendation
propia experiencia es
based on my
ser
experience
complementarios
is to
a lo
be
que el país hace,
complementary
no competir con el país,
of
no
what
competir con
countries are
otras
doing, of what different actors are doing,
sino
not compete with them, but
tener un
add to
diagnóstico, sumar
some,
los
create a greater
esfuerzos
sum of
y dar
efforts.
el siguiente paso.
Figure out where things are and help take the next step.
Asociarse con otros. O sea, hay un
Associate
fenómeno,
yourselves with others.
tal vez voy a decirlo acá, en un país, en un sitio llegamos a un
For example,
hospital inundado.
we might have had an experience of arriving to a hospital that was flooded.
Evacuar el hospital. Cuando voy mirando el hospital, una parte había sido donada por un organismo.
And I realized that part of the hospital was donated by an organization.
El hospital inundado había sido construido por otro organismo. Y así, eran unas para no
Different parts of the hospital had been built by different donor organizations, but they didn't work together. And everyone had good intentions, but it wasn't a good plan. And one sees that more often than they would wish. You have to create good alliances and then work together to create good plans. It's not sufficient to just have good intentions.
Excelente, muchísimas gracias. Sí, hay muchos ejemplos de eso.
Thank you. There are many examples like that.
Muchas gracias.
A mí me gustaría de pronto hacer una pregunta.
I'd like to ask a
Buenas tardes a
question.
todos. Mi nombre es
Good
Laura
afternoon.
Fernández. Yo
My
soy
name is Laura
médico
Fernandez.
general colombiana, egresada de la
I'm a
Universidad de
Colombian
pero en este momento
general
me
doctor.
encuentro en Estados Unidos haciendo una maestría
I'm in the
en
US right now
investigación
doing a
clínica que
master's
tiene
in
como
clinical care,
enfoque en la aplicación de innovación y tecnología para resolver temas de salud global y específicamente mi
and I'm focusing on
interés es
innovation,
la neurocirugía global.
and my
Entonces,
focus is
específicamente a los cambios
neurosurgery.
neuroquirúrgicos. El doctor Mauricio Cerpa y el doctor Leonardo Hernandez expusieron muy bien cuáles eran
This
como
was a
esos
really
retos del
interesting
territorio colombiano
presentation on what the
para
challenges are in
ustedes
Colombia.
implementar diferentes programas o diferentes innovaciones. Mi pregunta sería,
So my
en
question
base
is,
su experiencia,
based on
¿qué
your
es usted, al
experience,
contrario de esos facilitadores, o qué le ha servido a la OPS para que esos programas que se han implementado sean duraderos en el tiempo? Muchas
How
gracias.
has PAHO helped make these programs that you developed be sustainable over time?
No se le hace un seguimiento o no son sostenibles en el tiempo. De
How do you make sure things are maintained and
relacionado a la OPS,
given the follow-up?
programas ya implementados
How does the PAHO make
funcionen
sure that
hasta el día de hoy
programs
o
that
se
it
mantengan en el
implements
tiempo?
persist over time?
Leonardo, quisieras.
No, ve tú, Mauricio, por favor.
Sí, sí. Bueno, yo creo que es un punto muy importante, porque uno de los
It's
principios
a really important topic.
de trabajo humanitario es la acción sin daño, ¿no? Y
One
veces
one
encontramos que en el tema de
principle
la
is
acción,
to act
pues,
without
gente
causing
con
damage.
muy buenas intenciones, muy buenas ideas,
Sometimes there's really good ideas,
ya
really good
sea
intentions.
por lo corto de los proyectos, o ya sea por replicar alguna experiencia que pueda haber funcionado en otro país, pero
Maybe there's an attempt to replicate something that worked well somewhere else.
es diferente. No debemos, podríamos estar haciendo una acción sin daño. Yo creo que
We need to make sure that we're causing no harm.
voy a intentar rescatar es, primero es importantísimo
And a first step is
canalizar esa voluntad que se
to
tiene desde la
channel
junto
the-
con necesidades reales que
the will
existen
to work
tanto a nivel país como
towards
a
real
nivel
needs that
global.
are identified.
Y definitivamente quien más conoce esas necesidades
And those who
es
know
las
best the
autoridades
needs
nacionales o las
are
autoridades locales en
the
sí.
local or the
Están
national
ahí antes que
leaders.
vamos y los que se van a quedar una vez que nos vayamos. O sea, el integrarlos en
So
nuestras
they're the ones who are going to be
actividades
there when
es
everyone else
clave.
leaves. They are the ones that who know the needs
No
the
perder
best.
autonomía, porque necesitamos esa autonomía y esa
We need to
neutralidad
respect
en nuestras
the
acciones
autonomy
humanitarias, pero
of the
sí
local
tenemos que
of the
conocer
different
quiénes son
organizations.
los que vienen acompañando los procesos y que tienen probablemente ya identificados muchas de las necesidades. Entonces,
So
yo creo
always
que
turn to
ese
the local
es
actors to understand and identify the needs.
importantísimo. Otro punto clave es,
Another key point,
es importante yo creo, para el ejemplo específico de OPS es
which has specifically been important for the PAHO,
¿no? O sea, el intentar, no solo porque hayan proyectos específicos de tal enfermedad o de tal.
we need to not only have specific programs based on a certain illness or a certain need.
Es mejor el acompañamiento en un lugar donde vas a estar largo tiempo.
It's better to accompany
Que te puedas mantener
the local community over a long period of time.
Cuando hay proyectos, pues esas actividades se pueden multiplicar. Pero lo que, por ejemplo, intentamos cuando veíamos el tema de los territorios que les mostraba en los mapas.
For example, in the issue of the different neglected territories,
se junta el tema de menor acceso a salud, mayores dificultades económicas.
there are a lot of common problems, lack of access to
menor capacidad de
healthcare.
naturales, etcétera, etcétera. Entonces, pues, y veíamos en el mapa, ¿no? Estaba Chocó, estaba Guajira, estaba.
And there are all these different regions that have these just basic unmet needs.
Amazonas, y otras en general. Y desde OPS la estrategia que intentamos hacer es estar ahí.
So our strategy
Tenemos que estar con actividades mínimas por temas de proyectos.
is to be there present on the ground, even if helping with very small projects.
Mencionaría es, tenemos que desde los cooperantes
And as cooperating
cuál va a ser un poco la consecuencia de nuestros actos.
agencies, we have to measure very carefully what will the consequence be of our actions.
Muchos fondos durante muchos años. A veces un ejemplo específico podemos pensar que
We may be able to mobilize a lot of resources for a while.
parte de estos fondos al hospital de tal región que tiene una
For example, if I'm going to assign a bunch of resources to a specific hospital,
a estos migrantes, podría ser positivo, yo estoy seguro que son de muy buena acción, pero no necesariamente es la mejor decisión porque en cierta forma estamos a veces.
it could have an immediate positive effect, but long term,
Las responsabilidades
what will the effect be?
de los países. Yo antes de estar en
What are the national responsibilities going to be to carry on that work?
un ejemplo específico es que Haití recibía muchísimos fondos, por decir un ejemplo específico.
An example is
recibía
Haiti.
muchísimos fondos internacionales.
They received a lot of international funds.
Una enfermedad tan importante en el caso de Haití. La consecuencia de ese apoyo durante tantos años,
Over years,
yo estaba de todo el programa de tuberculosis,
to address
más
tuberculosis.
el programa nacional, más de 40 o 50 personas contratados.
They had more than 40 or 50 people
Pagada por el ministerio.
working on TB, but only one of those people was from the health ministry.
Que recibían, al final, pues siempre estarían ahí y debilitó realmente esa responsabilidad. Entonces, pues sí es verdad, tenemos que hacer muchas actividades teniendo muy presente las actividades de las consecuencias de nuestros actos. Otro tema
We have to
importante.
be really careful how our actions can affect what the consequences are going to be long-term on the national capacity.
Y qué se hace, y algo también importantísimo es esa programación de la programación de salida, ¿no? Es el momento de salida.
We also have to think a lot about how we program our exit from
haber estado ya durante un tiempo
a project. If we've been involved in something for a long time,
no se caiga.
make sure that when we leave, it doesn't fall apart.
Doctor Cerpa, muchísimas gracias. Muchísimas gracias al doctor Hernández también.
Thank you very much
Hemos pasado un
to
poquito
Dr.
de
Cerpa
tiempo,
and Dr. Hernandez. We've gone over our time.
sin conocer más y ha sido muy interesante esta
It's
charla.
been really interesting to hear from you. I want to say thank you.
Por su
Thank you for your
disponibilidad,
time and for your availability,
por darnos a conocer un poco más acerca de lo
for helping
que
us get to
hace
know a little bit more what the PAHO does in our region,
específicamente en Colombia.
and especially focusing on Colombia.
Creo que ya podemos dar por terminada nuestra charla. De nuevo, muchísimas
I
gracias.
think we can end our talk here.
A usted y al doctor Hernández y a la doctora también, porque queremos seguir en contacto con ustedes.
And we're going to stay in touch with you.
La Alianza G4.
We would like the PAHO and the G4 Alliance to work better, more closely with our working group.
A todos los que vinieron a esta charla, muchísimas gracias.
And thank you to everyone who's come for our talk today.
Esperamos el próximo mes también en ya nuestra reunión más grande.
We look forward to
Que tengan una feliz
seeing you
tarde.
again.
Doctor Cerpa, muchísimas gracias. Doctor Hernández, muchas
Thank
gracias.
you. Thank you very much. Good
Tengan una
night.
feliz tarde.
Ustedes también. Cuídense
Muchas
mucho.
gracias,
Gracias.
Good night.
Thank you
Good
very
night.
much.
Gracias a todos.
Gracias por el tiempo.
Gracias. Hasta pronto.